Welcome to Roadmap to Residency Evidence-Based Applications. Hello everyone, I'm Abhiraz. Welcome to our Club 250 Mathmaker sessions. We will be running through some questions with you guys to help you on your journey to a 250. And this video is all about psychopharmacology and antipsychotics. So which of the following best characterizes the mechanism of action of SSRIs and the sexual side effects experienced by the patient? A 35-year-old woman with a history of major depressive disorder is started on a selective serotonin reuptake inhibitor SSRI as part of her treatment plan. After a few weeks of treatment, she reports feeling more energized and less sad. However, she mentions experiencing sexual side effects, including decreased libido and difficulty achieving orgasm. The patient is concerned about their side effects and is contemplating discontinuing the medication. Which of the following best characterizes the mechanism of action of SSRIs and the sexual side effects experienced by the patient? Increased serotonin release and enhanced sexual desire, blockade of serotonin receptors leading to sexual arousal, inhibition of serotonin reuptake leading to increased synaptic serotonin levels and sexual side effects, increased dopamine release and improved sexual function, modulation of norepinephrine levels and enhanced sexual displeasure. So inhibition of serotonin reuptake leading to the increased synaptic serotonin levels. SSRIs such as fluoxetine, paroxetine, and sertraline block the reuptake of serotonin, leading to increased synaptic serotonin levels. Now, this elevation in serotonin levels can be associated with sexual side effects, including decreased libido and difficulty achieving orgasm. Now, increased serotonin release and enhanced sexual desire SSRIs do not increase the serotonin release, instead they prevent its reuptake. Blockade of serotonin receptors leading to sexual arousal. SSRIs do not directly block serotonin receptors. While dopamine plays a role in sexual function, SSRIs primarily affect the serotonin levels and are not known for directly decreasing the or increasing the dopamine release. Now, while norepinephrine is involved in mood regulation, SSRIs primarily target the serotonin reuptake and not known for direct effect of norepinephrine levels. So SSRIs like fluoxetine, fluvoxamine, paroxetine, sertraline, escitalopram, citalopram. Okay, mechanism is by inhibiting the serotonin reuptake. Clinical use is in depression, generalized anxiety disorder, panic disorder, OCD, bulimia, binge eating disorder, sexual, uh, binge eating disorder, social anxiety disorder, PTSD, premature ejaculation, and premenstrual dysphoric disorder. Normally, it takes 4 to 8 weeks for it to act and to show the appreciable effect. Adverse effect may be fewer than tricyclic antidepressants, and it may be serotonin syndrome, GI distress, SIADH, sexual dysfunction, maybe anorgasmia, okay, difficulty achieving orgasm, erectile dysfunction, and decreased libido, mania, precipitation of underlying bipolar disorder. Now, which of the following best characterizes the mechanism of action of SNRIs and the side effects experienced by the patient? A 40-year-old man is diagnosed with generalized anxiety disorder and is prescribed a serotonin norepinephrine reuptake inhibitor as part of his treatment plan. After a few weeks of therapy, he reports feeling less anxious and more able to cope with daily stresses. However, he mentions experiencing the mild nausea, increased heart rate, and elevated blood pressure. The patient is concerned about these side effects and concerning discontinuing the medication. Which of the following best characterizes the mechanism of action of SNRIs and the side effects experienced by the patient? Inhibition of serotonin and norepinephrine levels, norepinephrine release leading to increased synaptic levels and side effects, blockade of serotonin and norepinephrine receptors leading to improved mood, inhibition of serotonin and norepinephrine reuptake leading to increased synaptic levels and side effects, increased dopamine release and enhanced coping abilities, modulation of gamma aminobutyric acid levels and reduced anxiety. Now, inhibition of serotonin and norepinephrine reuptake leading to increased synaptic levels and side effects. So, SNRIs such as venlafaxine and duloxetine block the reuptake of both serotonin and norepinephrine, leading to increased synaptic levels of these neurotransmitters. Now, this elevation in serotonin and norepinephrine levels can be associated with side effects such as nausea, increased heart rate, and elevated blood pressure. So SNRI is like venlafaxine, duloxetine, milnacipran. These also inhibit the serotonin and norepinephrine reuptake. It can be used in depression, generalized anxiety disorder, diabetic neuropathy. Venlafaxine is also indicated for social anxiety disorder, panic disorder, PTSD, OCD, duloxetine and milnacipran are also indicated for fibromyalgia. Adverse effect increase BP, stimulant effects, sedation, sexual dysfunction, or nausea. A 28-year-old woman with a history of recurrent episodes of mania and depression is prescribed a mood stabilizer as part of her treatment plan. The physician explains that this medication is effective in managing both manic and depressive episodes associated with bipolar disorder. Now, the patient is concerned about potential side effects and asks about the medication of mechanism of action of the mood stabilizer. Which of the following best characterizes the mechanism of action of mood stabilizer commonly used in the treatment of bipolar disorder? Increased release of serotonin and norepinephrine, blockade of dopamine receptors in the limbic system, enhancement of gamma aminobutyric acid activity, inhibition of sodium and calcium channels, and modulation of glutamate receptors. So inhibition of sodium and calcium channels. Mood stabilizers commonly used in bipolar disorder are such as lithium and certain anticonvulsants like valproate and carbamazepine are believed to exert their therapeutic effects by inhibiting the sodium and calcium channels. Now, this mechanism is thought to contribute to their ability to stabilize mood and prevent both manic and depressive episodes. So lithium again affects the neurotransmission, decreases excitation, increases the inhibition, and second messenger systems, example G proteins. Okay, can be used in mood stabilizer as for bipolar disorder and treats the acute and manic episodes and prevents the relapse. The adverse effect may be tremors, hypothyroidism, hyperthyroidism, mild hypercalcemia, polyuria, teratogenesis. Narrow therapeutic window requires close monitoring of serum levels of lithium while administering the patient with lithium. So that the main thing about lithium adverse effect is that both GI and CNS symptoms should be there. Almost exclusively excreted by kidneys and most easily absorbed by PCT via the sodium channels. Thiazides, AC inhibitors, NSAIDs, and other drugs affecting the clearance are implicated in lithium toxicity. So which of the following best characterizes the mechanism of action of mechanism of action of atypical antipsychotics? A 35-year-old man with a history of schizophrenia is prescribed an atypical antipsychotic medication. The physician explains that this class of drugs is effective in managing positive and negative symptoms of schizophrenia with a lower risk of extrapyramidal side effects compared to typical antipsychotics. The patient is concerned about potential side effects and asks about the mechanism of action of atypical antipsychotics. Blockade of dopamine D2 receptors in the basal ganglia, enhancement of serotonin release in the prefrontal cortex, antagonism serotonin 5-HT2A receptors, and partial agonism of dopamine D2 receptors, inhibition of acetylcholine receptors in the hippocampus, modulation of norepinephrine reuptake in the amygdala. Antagonism of serotonin 5-HT2A receptors and partial agonism of dopamine D2 receptors. The mechanism of action of atypical antipsychotics involves the antagonism of serotonin and partial agonism of dopamine D2 receptors. Now, this dual action is believed to contribute to the efficacy in managing the both positive and negative symptoms of schizophrenia with a lower risk of extrapyramidal side effects compared to typical antipsychotics. So talking about antipsychotics, okay, there are typical and atypical. So typical is the first generation antipsychotics like haloperidol, pizodine, okay, trifluperazine, flufenazine. Atypical may be aripiprazole, okay, clozapine, olanzapine, okay, quetiapine. The mechanism of action is they block the dopamine D2 receptor. Atypical antipsychotics also block, in addition, the 5-HT2 receptor. The clinical use is most commonly in schizophrenia, as they treat both positive and negative symptoms of schizophrenia. The disorders with concomitant psychosis may also be treated with antipsychotics. Tourette syndrome, OCD, Huntington disease are also favorable in sort of antipsychotic treatment. Adverse effects are many. So antihistaminic action may be there, anti-alpha-1 adrenergic hypertension causing orthostatic hypotension may be there. Metabolic adverse effect may be weight gain or hyperglycemia or dyslipidemia. Endocrine may be hyperprolactinemia causing galactorrhea and gynecomastia. In cardiac, it can cause QT prolongation. It can cause neuroleptic malignant syndrome. The corneal deposits are associated with chlorpromazine. Okay, the extramyopyramidal symptoms are very, very important and tested in the examination and maybe acute dystonia causing muscle spasm, stiffness, okay, akathisia, Parkinson's symptoms, and tardive dyskinesia. Thank you for watching. Keep studying now.